Let me start by extending my best to you, your family, team, and organization as we all adapt to a new normal. And as the world responds to the outbreak of COVID-19, our thoughts are with the people affected and the medical professionals working around the clock to help those most in need. The COVID-19 outbreak is impacting all of our healthcare nonprofit fundraising friends and current clients. We want to share our thoughts to help you in times like this. First, maintain a positive attitude. If you think and act like you can't raise or ask for money now, you are right. But if you believe you can raise money in times like this, you're also right. Design your plan. Identify your top 100 most substantial, probable donors. Keep telling your story confidently. Tell them how your hospital is making a high impact. Talk about your preparedness. Talk about how your caregivers and service has been unrelenting. Demonstrate your hospital's dedication. So get in front of your grateful patients, friends, and supporters. They want to have trust and abiding faith in your hospital's leadership, your board, and your staff, especially your physician leaders and key leaders in times like this. They want to have a great deal of information about the hospital or the health system or the service or care. They want to hear about the powerful impact you are having on your community. Be unrelenting in making your calls and contacts. There has never been a better time to communicate with your grateful patients, friends, and donors. Write personal notes daily. Keep letting your donors and friends know how you're doing. Let them know there is no letdown in service, attitude, or care. Reach out to your best friends and most ardent supporters. Donors want to know you are maintaining peak service despite the adverse situation of this COVID-19 outbreak. Don't be timid. Show how unyielding your mission is. Take a leadership role in developing new ways to stay in contact. Talk about meeting the challenges of these times. Connect remotely using video conferencing, snail mail, or virtual gatherings. Make every contact a carefully planned call. Leave nothing to chance or intuition. It's not business as usual. Have a strategy in advance for every single call and every web meeting, and think about your objectives and plan how you will achieve them. Tell your story even more empathetically than ever. Make it emotional and dramatic. Make it personal. Share how your service is relevant, dramatic, and more urgent than ever before, especially for the community you serve. Talk about your mission. Talk about all those things that make your hospital or health system worthy of encouragement and support and philanthropy. Keep hammering away at your mission and how you touch lives in a way no other organization does. Talk about the dramatic results and the effectiveness of your hospital and the caregivers. Let everyone know. Tell everyone that you contact, your donors and your friends. Tell them how you have strengthened your programs and services during this outbreak. Don't talk about the needs of the hospital. It's not about your hospital or its needs. Discuss the added need in times like this of those you serve. Stress the needs of the community, those individuals, and those frail and elderly and patients that you serve. And if you are a faith-based organization, remind your donors of God's provision in challenging times like this. The scripture is full of stories and lessons and maxims. Remember, it is about philanthropy. That's what you're asking people to do. Show love and kindness. Remember, it's not about your hospital, and it's not about money. It is all about changing lives and saving lives. Talk with your donors and friends. Let them know how effectively you are caring, treating those scared or impacted. Share how you are touching lives of your patients in a way uniquely your own. Stay close to your best donors. Let your best donors know how much their support means to the hospital and to the health and well-being of the community. Let them know you can't do it without them. Let your major donors know how effective you are delivering care and keeping your steadfast mission of care at the forefront. Don't panic about this economy. The economy is cyclical. It will in time improve and turn. So be prepared. Begin your plans now. Design your strategy. Determine how you will raise funds when things get better. And understand that people's passion for your hospital often doesn't follow the rise and fall of the stock market or the economy. So keep your campaigns moving forward. Use the time to right the ship, or get better organized, or take inventory. Look at the big picture. Connect the dots to what's happening right now to the mission and the focus and vision of your campaign. I often say, be impatient in the process of connecting, but be patient in the results. So don't be timid about asking. Don't be scared off. Be willing to be daring. Do it because your needs are urgent. Share how you are touching lives and serving people. Deepen the commitment, the devotion, and the loyalty of your grateful patient donors, your friends, and your supporters. Realize that in most cases, many of your patients and their families are hurt considerably more than your top donors. Even for your friends and supporters who are now worth only half of what they had 6 months ago, they are still far better off than most that you serve: the underinsured, the frail, the elderly, the weak. Seek a gift or gifts to cover your preparedness costs. Ask if they will help cover all of your costs. Send out regular emails or e-newsletters, maybe once a week. Let your key friends and major donors know how effective you are and how you are caring. Share how you are dramatically impacting care and saving lives. There has never been a better time to communicate with your donors and friends, or a more exciting and challenging time. Share how you are working to your mission, your cause, and changing lives and saving lives. Thank you for allowing us to share our thoughts and ideas. If there is any way that the Health Giving team can ease your anxieties during this time, we are here to help you. Whether it's questions about fundraising in general, about a strategic plan, about a capital campaign or grateful patient program, or just a friendly ear of someone with experience who's been in the trenches and been through ups and downs before, we want you to know that we are here for you. Thank you again for everything you and your organization is undertaking during this unprecedented time in our country. Thank you.